close to 800,000 people die due to suicide every year. That is one person every 40 seconds. Furthermore, for each suicide that occurs, there are more than 20 different attempts, which makes it the second leading cause of death, especially among 15 to 29-year-olds globally. The sad truth is that young people are not the only ones who attempt suicide. Older people are usually faced with problems that seem to be permanent and unsolvable. Hence they often approach suicide more determinedly than the young and carry it out with terrible efficiency. Think about how depressing it may be to grow old, lose physical strength, and suffer pain and sickness. Little wonder so many commit suicides. In this video, we will discuss signs to look out for and what you can do to help someone planning to suicide. But first, let us examine some of the causes of suicide. While there is a link between suicide and mental disorders, many suicides happen impulsively in moments of crisis. Further risk factors include the experience of loss, loneliness, discrimination, relationship breakup, financial problems, the despair of chronic pain and illness, violence and abuse, conflict, the intention to inflict guilt on others, or other emergencies. Knowledge of the most commonly used suicide methods is important since it helps to devise prevention strategies that have shown to be effective. Around 20% of global suicides are due to pesticide self-poisoning. Other common methods of suicide are hanging and firearms. The following risk factors deserve attention. Alertness to these warning signs and risk factors may avert an attempt. 1. Chronic depression. Researchers report that 50% or more of those who kill themselves have a history of serious depression. Signs of depression such as fear of the future, accompanied by expressions of worthlessness, being a burden to others, or dwelling on problems should not be taken lightly. 2. Hopelessness. In some studies, even people who did not seem depressed were much more likely to be suicidal if they had no hope for the future. Expressing hopelessness about the future, or talking about feeling hopeless or having no reason to live should be taken seriously. 3. Alcoholism and drug abuse. It is estimated that between 7% and 21% of alcoholics kill themselves. Also, many suicides happen impulsively in moments of crisis, and it is during such a crisis that many people abuse alcohol or drugs. 4. Family influence. Studies reveal that members of a family touched by a suicide are at a greater risk for committing suicide themselves. The absence of supportive family members or other psychosocial support also leads to suicide. 5. Illness. Fear over physical decline, and the despair or chronic pain and illness can be enough to precipitate a suicidal response among some people. 6. Losses. The loss may be tangible, such as a mate or friend, a job, or a person's health. It can also be something intangible, such as self-worth or self-esteem, status, sense of security, high levels of shame, guilt, or worry. Such losses compel some people to suicide. In addition to these risk factors, the following warning signs should never be taken lightly. Previous suicide attempt. The strongest risk factor for suicide is a previous suicide attempt. It is the single best indicator of possible suicide. Talk of suicide. Expressing thoughts, feelings, or plans about ending their life, including through stories or pictures, are indicators of possible suicide. Statements such as, "They won't have to worry about me much longer," or, "They'd be better off without me," are examples of obvious threats. Final arrangements. Such behavior includes making a will, giving away prized possessions, and making arrangements for pets are also examples of obvious threats. Personality or behavior change. Changes in mood, for example, regularly becoming tearful, crying, or displaying severe emotional distress. Also, changes in behavior such as a withdrawal from others, loss of interest in activities they usually enjoy, a change in eating or sleeping habits, recklessness, or an increase in anger as an indication of possible suicide. Again, disruptive behavior, including conflict with others and marks of cutting or self-harm, deserve complete attention. Now that we are aware of the possible risk factors and warning signs, here are some of the things you can do when suicide is imminent. 1. Talk to the person in a private space, conveying your concerns, and actively listen to what they say without judgment. Express empathy and concern and try to establish a positive rapport. Encourage the person to talk and lead into the topic gradually. This can reduce anxiety and help the person to feel understood. 2. Restrict access to the means of suicide. If the person has attempted to or indicates that he is about to intentionally harm himself, remove access to means. For example, pesticides, firearms, or other medications. Do not leave the person alone. Seek immediate support from health services, if available, and stay with the person until further specialist support is in place. 3. Encourage the person to speak to someone they trust, such as a parent or other trusted family member, adult, or health worker. Offer to speak with the person identified, but do not do so unless the person wanting to suicide agrees. Ask if there is anyone they would like to call or have called. 4. Seek medical assistance for the treatment and care of people with mental and substance use disorders, chronic pain, and acute emotional distress. 5. Help the person to develop skills to cope with life's pressures. Remind the person of his strengths and encourage him to talk about how he resolved problems in the past. Help him explore powerful reasons to treasure life, even under very difficult circumstances. 6. Make follow-up care for people who attempted suicide. What you should do following a suicide attempt. 1. Check vital signs and, if needed, provide emergency first aid. 2. If medical attention is warranted, make sure the person is taken to an emergency care facility. 3. If the person is responsive, try to communicate in a non-threatening, calm, empathetic, and friendly manner. 4. Initiate communication by asking open-ended questions. Be non-judgmental and do not make the person feel guilty. 5. If transfer to a health care facility is not warranted, remove anything that could be used for a suicide attempt from the scene and ensure that a family member or close friend is available to ensure the person's immediate safety. 6. Connect the person and any accompanying persons to mental health services or community health services to ensure follow-up. Have you learned anything useful in this video? Let us know in the comment section. Also, let us know if you have any questions or topics that you wish to discuss. And if you enjoyed this video, please like, share, and subscribe to the Smart Life channel, and together we will motivate, set and accomplish goals, and build resilience. See you in our next video. Until then, stay safe, stay well.